Okay, so I am finally back home after the longest appointment of my life. It is, I don't even know what time it is. It's almost 1:30. My appointment was at 9 o'clock this morning with the surgeon. Um, so basically, what had happened was we went into the office. I met with the nurse. Then the doctor or my surgeon came in and he kind of explained. I got stuff in my teeth. Oops. So he kind of explained what was going on and how he was going to do the surgery. Basically explained to me what the ileostomy would be, and just sort of like what he does, which is cool. Um, it's pretty standard stuff. I've been researching for a while, so I kind of already knew what I was getting myself into. But when I got there, I made sure to ask for my stoma nurse, which I still didn't know who that would be, or if I would have one, or if I was even seeing one today. But when I asked, they said that they would send someone over, and I met a lovely woman named Nancy. She's really sweet, and she brought me this booklet, which I guess I'll insert a picture or something once I figure out how to use video editing stuff. But it's just basically a kit, and it comes with your ostomy information, a fake little ostomy that you can kind of practice with. Came with a fake ring, like one of those ring barriers that you put around your stoma. It also came with a bag that I was trying out. She stuck it onto my belly, and I also got marked today, so I'll show you the mark. I unbuttoned my pants for this reason. But this is going to be the positioning of where my stoma will be. She basically matched it up. I stood up a few times, bent over. She kind of like felt where my muscles were, and she positioned it in a way that we kind of both agreed on. So originally I was thinking about doing it a little bit higher up on my stomach, which it looked okay to me, but then she was like, well, why don't we put it just a little bit lower? And that seemed actually kind of okay. So at my hospital, they do a Hollister 2 pieces for the initial surgery, and like after, those are the type of bags that you use. I think it's the New Image. I have a sample of the bag with me. But yeah, they just gave me the bags and all kinds of different stuff. It was a good experience. I feel really well informed. After my stoma nurse, after we talked, I asked her all kinds of questions, different things that kind of popped up, like how do I get my ostomy supplies, which she told me just to call the different companies. She gave me like a list that had, Coloplast, Convatec, Hollister, some of the other different brands. And she said just to call them and to grab samples from them, to request them, which is fine. I think I'm probably going to do those phone calls a little later. I'm really tuckered out. It was just a lot of stuff. And I was just way too tired. I couldn't sleep the night before, so it was kind of antsy. They also give you this like bathing prep, which I had never heard of. I guess, I don't know, all the videos I've watched, no one ever mentioned that there was like this soap that you have to use, and you have to like wash your whole body. So like you wash your face first and your hair and like your genitals with regular soap, your usual stuff, and then you go in with this, like, it's like a little bottle, like maybe that big, and you just like do everything, like all of your skin, and you have to do that 3 days prior. And then they gave me, my hospital actually provides pre-surgery nutritional drinks, so I have to drink 3 bottles. They kind of look like Ensures if you've ever had them. I'm pretty sure they taste similar. I'm gonna have to drink one probably while I'm in my bath after this. Not looking forward to it, but there's just a lot of stuff to drink. So they give you 5. It's 5 days before the surgery. You start taking 3 nutritional drinks a day, and it's supposed to promote like healthy cell growth and development and healing for your recovery, so that you can leave the hospital faster and like feel better sooner. So I'll definitely be taking those. One thing I didn't know going into it was that I had to stop all of my multivitamins. I take a prenatal right now for added vitamins and possibly for a future baby. I hear it's good to take your vitamins, before you're planning to have a child. So that is a couple questions. That is something that I did ask as well. Like, what are my chances of being pregnant, getting pregnant, things like that. And that seems to not really you don't really have much of an issue in the way of that unless you have your J pouch, which lowers your infertility more. But I still could get pregnant with a stoma. And, maybe I'd have to have a cesarean, possibly, but there are people who do vaginal birth as well, so I don't see a problem in that particularly. How did I get on that topic? Oh, yeah, prenatals. So you're not allowed to take anything with vitamin E inside of it, any other supplemental vitamins or herbals. So I won't be taking any of my multivitamins 5 days prior or 6 days prior to the surgery. Trying to think what else. Okay, so then after I finished my pre-op surgery appointment, met with the stoma nurse, met with the surgeon, signed some consent forms for like them to give me blood and all of that jazz. Then I met with the anesthesiologist, and I took a pregnancy test while I was there. Negative. I live to see another month. Anyway, so I did my pregnancy test there. That came up negative, and I just talked to the anesthesiologist. She asked me if I had any loose teeth, any lung problems, any heart problems, anything that would interfere with, the giving of anesthesia. But she said I was pretty much a prime person to get it, if that makes sense. Like, I don't have any like super big like heart and lung issues or anything like that, so I'm not going to really have any issues going into it. What's really cool is, since I'm getting a laparoscopic surgery, hopefully, like, it could turn into like full abdominal, but they're just going to try to do laparoscopic for now. But getting in the surgery, they're going to this is where my stoma will be, down here, and then like on this side they're gonna do some holes, and then like right on the bottom they're right next to my pelvis bone. Sorry, I'm wearing a diaper, hence the reason why I'm getting this little guy. But yeah, they take out your colon like underneath here. Like, it's gotta have a way to get out, so they make an incision here, then like one up here and here, and then I'll have obviously the stoma. So those will be the injection sites, but afterwards, once they like close you up and finish, they actually give you like this painkiller. Like, they inject it directly into the wound, so you're supposed to wake up like feeling comfortable, which I thought was cool. I was like, give me all the drugs you can, because I do not want to be in pain, and I'm hoping that it'll be manageable. But living with UC, I kind of have pain every day anyway, so I'm kind of used to it. We'll see how it goes. But yeah, that was my pre-op appointment, and I'll probably take a few pictures of the prep stuff that I had to do, and I'll take a picture of the kit that I had that I got to bring home with me. But yeah, that's it for now. Bye, guys.